We were founded in 2011 with a mission of transforming lives impacted by crime through healing services and relationships. Our work began in custody at the juvenile and adult level, and then we built a continuum of care from in to out, expanding all of our programs to wraparound services for reentry purposes. Well, I would say prior to NHHA, we struggled with a lot of infrastructure, operation systems, administrative strain, insufficient billing and data systems. There was a lot of gaps in trying to track our work.
They are part of the community. They're trying to serve this population, and they've done it from the heart. That's the most important thing. And what we see is that what Restorative Partner needs is the ability to expand their funding revenue, number one. Number two, to really help them incorporate all the silos within the agency, within the organization, so that they're able to provide a client-centered, whole-person care approach to services.
Yeah, financial realities were staff were going to lose their jobs because we didn't have the funding to provide the services. And after working with NHHA and taking on the CalAIM program, we were able to just boost that from a financial perspective and also services.
One of the things that CalAIM has brought to the table for Restorative Partners is the ability to serve the needs of the underserved in our community. When CalAIM was first launched at Restorative Partners, the revenue numbers were around $3,950 a month. Over the last 12 months, we've managed to scale that out where it's almost $41,000 a month that we're bringing in. This accounts for almost $318,000 in revenue now that serves to encourage and utilize to serve the needs of the underserved in our community, along with the HIP grant for almost $200K that will enable us to expand the services in our community and bolster our existing programs that we currently have. Before NHHA, I think the model was basically day-to-day and month-to-month operations to facilitate serving the underserved in our community. I don't know that there was a real strategy around long-term sustainability.
We always start with listening and thinking about what do they articulate as their priorities, what matters to our client, and then we start to dive in. We are very focused on not just producing deliverables that sit on a shelf and become dusty, but that are actually useful and that can be used throughout the implementation process for these programs to ultimately improve the health and housing outcomes of our communities.
Once we began working with NHHA, being the person who's doing the billing and the reconciliation and the data, I can see the growth, and not just the growth in financial, which is also very evident, but in our enrollments and the services we provided and the outcomes we've had through community supports and the housing trio and through ECM. So I would say that the time we spent together was really impactful in terms of client services and also in terms of financial, because we have a base to be able to provide these services for clients. And in our county, I would say we are the best equipped to provide services to justice-involved individuals because that is our mission. And that's a population where there's a huge gap.
They will do intensive work. This group has been meeting with us twice a week for 14 months. That's a huge commitment. But in that commitment is born what our mission says, relationship. And out of relationship comes a whole lot of learning, loving, and moving forward with our mission.